Welcome to this podcast on identifying obstacles to staying at and returning to work, also known as blue and black flags. My name is Burton.
And mine is Kendall. Welcome back. In the second part of this podcast, we are going to look at flags as obstacles and how to identify them. There are four colours that these are coded into. Red flags are signs of serious injury or disease. Yellow flags are those to do with the person. Blue flags to do with the workplace. And black flags to do with the context in which the person functions. So, what do we mean by the term flags? Well, flags are indicators that further attention needs to be paid to the particular problem. This is usually in the form of finding out more about it to ensure all potential obstacles have been identified and understood. Flags are also an aid to bringing the biopsychosocial model into everyday practice. They offer an understanding of why some people with musculoskeletal problems don't recover as expected. They also offer a method to identify and tackle those obstacles to recovery or work. Flags have a dual role. They can help us to select individuals who are most likely to need additional help, but crucially, they also point to those specific obstacles that need to be tackled. The focus of this podcast is the blue and black flags, but before looking at those in detail, it's worth just quickly summarising the three main types of obstacles that we are going to encounter. The yellow flags refer to person obstacles. These are thoughts, feelings and beliefs, especially about the relationship between symptoms like pain and activity or movement. They involve worry and distress, fear and uncertainty, negative expectations about recovery, not believing that one's going to get better, and passive behaviours, such as waiting for somebody to do something to you. Blue flags, the workplace obstacles, refer to things like low job satisfaction, belief that work or activity is going to be harmful or damage one's body, the lack of modified work or the line manager not providing job accommodations, and a lack of communication by the employer. The black flags or context obstacles refer to things that involve social systems, the cultural acceptance of pain and injury, perhaps minor injury, compensation if you have to prove you're ill, you can't get well, and certification. The footnote is a great idea, but that's only if the person believes it. Okay, let's look at identifying blue and black flags at the workplace. We'll begin with a quick overview of some useful questions to ask everyone as a way of trying to identify obstacles. First question is, what do you think has caused your problem? What do you expect is going to happen? How are you coping with things? Is it getting you down? When do you think you'll get back to work? And what can be done at work to help? Each of these can help to identify obstacles in general, but now it's time to look at what specific obstacles to look for. High physical job demand refers to jobs with especially high or sustained biomechanical exposure. The problematic level of exposure will be lower for symptomatic workers. Note that job demand may be subjectively perceived or involve actual high loadings or a mixture of both. To evaluate it, we need to identify job characteristics and the individual's concerns about them. Look for inflexible work schedules that do not allow appropriate breaks. A good question to ask is what type of tasks and activities does your job entail, and follow this up with how is an average working day structured. Negative expectation of recovery and return to work refers to the belief by the person that they're unlikely to get better and get back to work. This contributes to a sense of helplessness and undue pessimism. It's often associated with two types of mismanagement. The first is a focus on symptoms by asking people how they are feeling instead of asking what activity they have been doing. And secondly, a focus on what people can't do rather than what they can do. Negative expectation leads to low self-efficacy, so the person lacks a sense of mastery over their pain problem, their symptoms, and this often encourages passivity and a steady downward spiral toward low activity levels. Restoring a sense of optimism can be achieved through ensuring the person attains goals progressively in steps small enough that success can be guaranteed. To evaluate it, identify pessimism about recovery and return to work. This can be a belief that a certain period of time needs to elapse before the person feels better, or that some intervention, like surgery, needs to happen before they can even contemplate working again. Start by asking, do you think that your pain will improve? And follow it up by asking, do you think that you will return to work? Job satisfaction refers to how content an individual is with their job. Low job satisfaction or job dissatisfaction can reduce the likelihood the person will return to work when they experience a pain problem. Many factors can contribute to job satisfaction, and these may require careful questioning to clarify. They may include a range of personal factors, life goals, home situation, history, etc., or workplace factors, such as interactions with co-workers or line managers. To evaluate it, identify job satisfaction with respect to factors such as work routine, management, salary, possibilities for promotion, and co-workers. Begin by asking, how satisfied are you with your job, taking into account the factors above? What aspects of your job are most dissatisfying is a good follow-up question. Low social support or social dysfunction in the workplace refers to the person's perception that they lack support from other people, whether it's at home or at work or both. Sometimes there's a degree of interpersonal conflict in the workplace. The most common interpersonal difficulties encountered by people with musculoskeletal pain problems are, firstly, frustration or anger expressed towards them, perhaps as a consequence of their symptoms or inability to engage in activity or work, and secondly, over-solicitousness, where a significant other is over-helpful in a well-intentioned way but ends up inadvertently encouraging activity avoidance and unhelpful beliefs. To evaluate it, identify the perception of low level of support from the person's social network. The actual support may be adequate, but it is the perception that is important. Ascertain which members of the social network are the most important to the person with respect to the pain problem, and evaluate how their responses and actions influence that person. Begin by asking, do you feel supported by other people? And follow it up with a question, are you supported at home and in the workplace? The perception of stressful job demands refers to the person's belief that their job is stressful. This means that they believe it demands more from them than they are willing or capable to give. To evaluate it, we need to identify the person's perception of stressful elements in their job and evaluate how realistic this is. Begin by asking, are there stressful elements to your job that you find difficult? And follow it up by asking, what might help you cope better during an average day at work? Lack of job accommodations or modified work refers to the absence of opportunity to stay at work or resume work, with the help of transitional work arrangements such as work organisation or work tasks. Workplace accommodations can provide the person with the opportunity to maintain or regain their regular work habits and relationships with their line manager and co-workers. They are usually temporary. There are two major types. One, changes in work organisation, such as using a different schedule for work, or for example, allowing someone who cannot drive or use public transport to work at home during the transitional period, or to exchange problematic secondary tasks for part of another employee's job description. And secondly, changes in the biomechanical aspects of the job, such as modifying the physical environment or changing the job tasks or workloads. To evaluate it, we need to identify what the person can do, with less emphasis on what they cannot do, except for safety-sensitive issues, and to identify job tasks that can be done. Look for practical ways to begin the return to work process and use a graduated approach whenever possible. Begin by asking what parts of your job can you still do, and follow it up by asking what do you need to talk to your line manager about in order to resume working. Lack of employer communication with employees refers to an inadequate management style. The duration of time off work is reduced by contact between healthcare and the workplace, but also, more importantly, between the line manager and absent workers. Lack of effective communication is a major obstacle to vocational rehabilitation and the return to work process. In general, it needs to be improved through the development and use of practical and effective methods. To evaluate it, identify what communication has occurred and between which key players. Begin by asking, has your employer or line manager made contact with you since you stopped work? And follow it up by asking, has there been any communication between healthcare providers and the workplace? Now we move to considering the first of our black flags, which is misunderstandings and disagreements. This refers to differences in approaches or disagreements that may occur, for example, between an employee and the employer or with the healthcare provider. Disputes and disagreements can arise when communication between key players is lacking or ineffective, especially when they misunderstand each other, and it can contribute to a profound sense of blame on one part or the other. To evaluate it, identify contradictory or conflicting approaches. Begin by asking, do you understand what is planned? And follow it up by asking, does everyone know what the plan is? Financial and compensation problems do occur. This refers to a range of incentives and disincentives that might happen due to the provision of financial support to the person. To evaluate it, we need to identify financial disincentives to resuming work. Delays in accessing income support or disputes over eligibility, and things like history of multiple claims with time off work. First question to ask is, do you feel encouraged or discouraged to return to work? And follow this up by asking what, if anything, is holding you back. Process delays are another real-life obstacle that does occur, even though ideally they shouldn't. It refers to the range of potential problems that result in the person experiencing delays. This could be due to administrative mistakes, waiting lists for healthcare or other appointments, delays in claim acceptance or accessing income support, or disputes over eligibility of a claim. Evaluate this by identifying any delays and the associated distress and frustration. Begin by asking, are you waiting for anything to be done to help you? And follow up by asking, what is it? We also need to be on the lookout for overreactions to sensationalist media reports. This refers to information that gets into the public domain heralding the possibility of new treatments with an overhyped description of their effectiveness and suggestion of impending availability. There are expectations that modern medicine can cure or fix injuries and diseases that commonly include musculoskeletal problems. This prevailing view is fueled by a number of sources, including enthusiastic clinicians and popular media reports. It can be intensified by news of new technological developments. The effect of expecting a medical cure can be to reinforce the notion that something is damaged, to encourage the belief that a cure exists, to strengthen the idea that pain must be completely relieved before commencing rehabilitation and activity, and that a clinician is responsible for getting the person better. Identify this by looking for expectations of a quick fix or a miracle cure, and be alert for requests for new unproven health technologies. Begin by asking, what do you think will help you recover? And if necessary, follow up by asking, have you heard of any new treatments? The last black flag that we need to consider is the presence of unhelpful return to work policies or procedures. And this refers to anything used by companies, workplaces that hinder the process. Remember that effective vocational rehabilitation requires healthcare that includes a specific focus on return to work and workplaces that are accommodating. In addition, there needs to be suitable communication and coordination of the return to work process. Previous negative experience of workplace management and absence of interest by an employer, or previous experience of ineffective case management, may contribute to negative expectations and beliefs, and therefore a poor outcome. Evaluate this by identifying inadequate or lack of return to work culture or policies that interfere. Begin by asking, is there a policy for helping someone to return to work? And follow this up by asking, what does it involve? So by way of a brief summary, it's good to remember to always find out about physical job demands, the ability to modify work, job stress or how it's perceived, workplace social support or dysfunction, job satisfaction, the expectation for resuming work, and any fear of re-injury.